So we now have some new testing here at Boling Vision Center, VEP, which is Visual Evoked Potential, and ERG, which is electroretinogram. Both of these are measurements of the physiologic activity, the electrical charge that occurs in the eye. For VEP, it measures the intact visual system from the very front of the cornea all the way back to the occipital cortex where those visual impulses are interpreted. So we have little electrodes underneath your eyelid, on the front of your forehead, and in the back of your cranium. And those measure electrical potentials across those areas, not only what the electrical amplitude is, which is the strength of the signal, but also the latency, or how long it takes an impulse to occur from where it's given to where it is interpreted back here. So those two things, the amplitude with the visual evoked, we're talking about the visual evoked potential here. The amplitude tells us a little bit about the health of the whole visual system, and the latency tells us how long it takes for that signal to get from the front to the back. For a normal latency, or a normal time for that signal to get to the front to the back, you have to have good insulation around your wires. So in other words, your nerves in your brain, your optic nerve and all that stuff can't have any loss of myelin. We lose myelin in a variety of disease states, one of which is multiple sclerosis and optic neuritis, and some of those disease states slow this latency period, so it helps us decide why vision is decreased in a person that otherwise it's very difficult to tell. We have no other imaging studies that can help us decide that, but we can tell by how fast and how large this amplitude gets to the back of the brain as we're measuring it where the potential problem is. So VEP, the whole visual system from the front of the cornea to the occipital cortex, the computer in the back of the brain that measures your vision. And then ERG is a measurement of the electrical activity in the retina, and it's just sustained right there in the retina and limited to the retina. So various retinal problems like diabetes and glaucoma and macular degeneration, all those kinds of things can affect the ganglion cells in the retina and affect how large of an amplitude that has. So in an ERG, we're looking at different types of patterns that we consider normal. And one of those patterns is a sinusoidal wave, kind of 3 peaks in a mountain range in each of our testing. And then we measure the various peaks in these mountain ranges with a really high contrast black and white measurement versus a relatively low contrast kind of gray and white measurements. And then we compare those two. And those two amplitudes and those two sinusoidal waves and the time it takes, again, a latency measurement, all helps us decide the health of the retina. So this is another way we can measure the health of the visual system. VEP, the whole eye, ERG, primarily retina, and sometimes optic nerve from glaucoma as well. And we can use that bit of information combined with the other bits of information we get, because there's no one perfect way to follow many of these ocular diseases. For instance, glaucoma, we do several things. We check pressure, we look in the back of the eye, we do visual fields, and we do these OCT machines which measure the thickness of the nerve fiber. Now we have another measurement that can help us decide, are we treating like we should? If we're not sure if we should advance therapy to another drop or maybe progress to surgery, this other information, this other bit of a test can help us make those decisions. So it's going to be valuable to us, and it's new. That used to be this type of technology was only available in medical centers because it's very advanced and very specific and complicated, but now with the new technologies we're able to do it in our offices. So we're excited about this possibility for measuring and helping our patients even further.